Okay, hello everyone. Hello everyone that is here and also the people that is in the video conference. I am Elisa Martín. I am the director of the Health Predictive Analytics in the Instituto de Ingeniería del Conocimiento. If I translate this in English, it's something like Knowledge Engineering Research Institution. So I am not a doctor. However, I was sitting in that church during the last 3 days, and if I am able to summarize something in related with everything that I was listening, I can summarize that in just one sentence. We should anticipate. This is what I am learning from the last 3 days. So I think after the lunch, it is a good moment to talking about how we are able to identify the risk of a patient if the patient is going to develop sepsis in the next 24 hours. This is what we are going to talk about in the next 30 minutes. We have here Anna. Anna is one of my colleagues. She's working in my team. She is the coordinator, the technical coordinator, and also the responsible of the model. She is working with Christina. Christina, could you start up? Christina is the product owner, and really she is the person responsible of the product, okay? And she is going to set up the context, okay? Because later on, I am going to talk with these 3 champions that I am here, okay? There are persons that have been working with the project during the last years, starting from last year, isn't it? Okay, sure. So this is what we are going to do. So Anna, could you start and set up the context?
Yes. So, as Elisa said, my name is Anna, and I have no medical background, but I am a data scientist at Instituto de Ingeniería del Conocimiento, and I'm going to present BeAlert as an introduction to the Simposyum. So, BeAlert is a software that serves as a clinical decision support system for the prediction of sepsis and septic shock. And as you see, when a patient is hospitalized, some measurements of their clinical and laboratory variables are routinely taken from them and recorded in the hospital's IT systems. So BeAlert automatically reads these measurements and inputs them to an artificial intelligence model, which predicts whether the patient has risk of developing sepsis in the 24 hours that follow the measurement of the variables. And so if the model does predict that the patient is going to develop sepsis, then the healthcare professionals at the hospital see an alert. And this is the main interface of BeAlert, where alerts can be seen. So BeAlert combines both the artificial intelligence model and also a traditional scoring system. And it combines both outputs in color-coded alerts, as you see there. And also, we gather feedback from the hospital to constantly validate prospectively the model's performance and do some adjustments if they are needed. So BeAlert, the project that led to BeAlert, started in Llàtzer Hospital with Marcio in 2018. And these are some results from the retrospective and prospective studies that we did in 2021. So as you see, the sensitivity is very high, while the specificity is high as well. And this means that BeAlert almost never misses a patient that is going to develop sepsis, but at the same time, it doesn't overpredict and generate too many alerts. And regarding the last version of BeAlert, we installed it in Llàtzer in May. And we just recently installed it in the emergency department of the 12 Octubre hospital in February. And so since this moment, BeAlert has been generating predictions, and these predictions have involved more than 36,000 and 5,000 patients, respectively. And of these patients that have been monitored by BeAlert, around 15% of them generated an alert at some point of the hospitalization. This is a summary of the most obvious benefits that BeAlert can bring if it is integrated in the system and in the daily life of a hospital. But the main message to take from the slide is that the use of an artificial intelligence model in supporting clinical decisions can take into account many more variables than what the human brain is used to, and this allows to account for each patient's particularities, and it helps the professional in a more personalized diagnosis. And before I finish, BeAlert is about to get CE certified in May. And apart from being installed in 2 hospitals, we are also preparing another installation in the General Hospital of Albacete. And these are the milestone dates of our plan. So in May, as I said, BeAlert is going to be CE certified. And from that moment, it will be available for commercialization. It will be on the market. And we are also working on extending BeAlert to the prediction of other diseases, such as cardiac arrest and respiratory compromise. And so next year, in 2021, it can be expected that BeAlert is a multi-disease platform. And now my peers are going to have a discussion about this. So thank you very much.
Thank you very much, Anna. So let me to start the round table, and I am going to start with you, Marcio, sorry. Sorry. So everyone knows you, so I am not going to introduce you. However, you are working in the project from the 2019, okay? And I liked that you explained to us what was your motivation to start with this project, why you start this project with machine learning, okay? And what you expected at that time about the project.
Yeah, thank you. In the last 3 days, we talk about the problem of sepsis, the impact of sepsis in mortality and resource uses, and the great problem is the detection, or in other side, the prediction of sepsis, and before that started, no, in the pre-sepsis status, no. So we were working in sepsis since 2006 in my hospital. No? 2011, we create one special program for early detection sepsis using 15 variables, common variables as SCRS plus SOFA, and sepsis 2 criteria, and have this big data is real time, but the problem is this program, the special program, identify almost 100 patients by day, and only 10%, 50% are really sepsis. So the advice in the 70% of cases are false positive cases of sepsis. No? So since a few years ago, no, with your company, we were working together to improve this way, improve the early identification of sepsis, because sepsis is a time-dependent syndrome. So the most important, of course, they use the best antibiotic, the best hemodynamic monitoring, best drugs, hemodynamic drugs, but most important, the time. So if you have a tool that can possibility the early detection of patients in the patient with only one organ dysfunction, no, this is a quick question to improve the prognosis of my patients. So in these years, no, this tool helps so much for us in the first, in retrospective, for second, the pilot prospective, and now in the prospective early warning in real time and for all patients, for all physicians in our hospital. No? This had a warning in real time for all adult patients in our hospital. No? So these two help so much in our working day by day with my patients.
So have you covered your expectations?
Very high, of course. It's not magical, no? It's day by day we're working to validate the patients, validate the false positive, false negative cases, no? Because the two must be learning, no? With supervised learning, no? But improve the early detection of patients and that use the better model, this better combined is machine learning techniques plus a traditional role. No?
Okay. So Jaime Cruz, el doctor Jaime Cruz, you are pediatric and also working in the head of digital transformation in the Hospital 12 de Octubre. You are just starting in the project, so we start to produce alerts from the beginning of February, okay? But I have the same question for you. What was the motivation to start this project, and also what is your expectation for the project?
Thank you, Elisa. Thank you, Elisa, and thank you, Marcio, for your kind presentation. Such a strange profile mine as a pediatrician in an adult forum. But, well, as I work in the digital transformation unit in my hospital, we really want to improve the diagnosis, the early diagnosis of patients with sepsis. It's a really need in every hospital and also in ours. We are also concerned about detecting patients with sepsis with atypical signs or vague signs, not the evolutionated ones. So that those patients are the ones that we expect to diagnose thanks to this tool. We are not yet, we don't have the tool in production setting, we are validating the alerts generated by the tool. So
yeah. And this is also very specific because what with the hospital, we try to also to validate the project with the emergency services.
That's right. We are trying to, we will start in the emergency department, not in the admitted patients. So that's, we have to be aware of that because the algorithm was trained with patients, not only in the emergency, but also the admitted ones. And also, the profile of the patient might be different also because it was trained in a different hospital, different level of complexity. So for sure, we will have to validate the sepsis ones in order to retrain the algorithm. But we are very happy and to have this tool.
Okay. José Javier, Dr. José Javier Blanch, you are working in the Infectious Disease Unit en el Complejo Hospitalario Universitario de Albacete. You still are in the bureaucracy step, so you really are not starting with the project. However, I have exactly the same question. What was the motivation to start with the project, and what is your expectations?
Thank you, Elisa, and thank you to the organizers for your invitation to the meeting. First of all, sepsis is not only a global health problem, but I think it is also a specific issue within hospitals. Because if sepsis is one of the most leading causes of hospital mortality, then sepsis is not only a problem within the community, but also extends to the hospital. The Tecnosepsis project began in our hospital in 2016 within the aim of improving the management of sepsis and reducing associated mortality. This project includes all services, all medical and surgical wards, and the intensive care. And the project was born out with the support of our hospital management. Now, this project, the Tecnosepsis project, is implemented, but we still have areas of improvement. And one of these areas continues to focus on early detection of sepsis, both for patients in the emergency department and also already hospitalized. So the motivation behind the onset and implementation of B-Alert has been the need for reliable tools that assist us in the early detection of sepsis. Another motivation is time saving and efficiency. Regarding work efficiency, it won't be as necessary for medical and nursing staff to constantly, to be always thinking in sepsis, because now the systems, or that's what we think, will assist us. With regard to the expectations in our project that includes all hospital services, I say it again, we seek the best combination of work efficiency, time saving, and diagnostic accuracy. One final expectation is that B-Alert will provide us with the option of to obtain management metrics. In this way, we will have tools to evaluate how we work, and it also is, it can be a communication tool with our hospital management.
Okay, so you have a very high level expectations, so that's good, okay?
Yeah.
And also I think it's one of the first projects, first hospitals that we are going to go into the impact in the management of the hospital.
Sure.
So that's for sure that we are going to be at the level that you expect. So, Marcio, well, you have been working with the product for a long time, so for sure that you have lessons learned, for sure that also you have, you understand what was the impact in your patients and also the impact in your team, how the team works.
Yeah. An impact for our patients is decrease the number of the warnings, the false negative, false positive warnings. So this decrease the working of our team. No? Another very important lesson is that's the early identification. For us, for our team, for our hospital, for our colleagues, for other services, such as emergency department, internal medicine, surgery people, ICU. The problem is many times these patients was identified a longer time. No? So using this B-Alert, we can to identify these patients before. No? So this impact for us, for patient, no, is these patients, if identified before, I started before antibiotic, I start before one hemodynamic monitorization, if possible, start microbiology tests before. No? This is impact for us, no, that use the tool day by day. No? And on the other hand, is possibility that know the patients in all parts of the hospital. This is important. It's not only ICU. No? And possible to identify different kinds of patients, complicated patients. Sometimes they don't know if have infection, sepsis, or other disease.
Mm-hmm. Jaime, you are starting in the emergency services. So what is the challenge that you expect to have in the emergency services? Is setting the B-Alert there?
Probably the challenges are, as this is a big hospital in Madrid, Spain, attending more than 600 emergency visits per day, lots of professionals working there. So it's a challenge to convince all that staff that the alert works and to implement the things we have to do when the alert pops up. Mm-hmm. So that's one big challenge. Another big challenge I think we have is to try to identify different patients with different profiles than the ones that were used for the training of the algorithm. especially the pediatric patients, for example. As we know, there is no, as far as I know, any artificial intelligence model for detecting pediatric sepsis.
Yet.
And we will really like to work on that. So, and it is a challenge because as everybody knows, the vital signs, the range of normality of vital signs in pediatric population varies a lot from adult patients. So for us, it will be a pleasure and a honor to push that up.
Yes, because currently BLR is only for adults. The model is training only for adults, as we did in Llàtzer.
Yeah.
Okay. Jaime, you don't start, okay? But I think it will be useful for the audience to understand what was the main challenge in this path, okay? From you decided to join the project in last May, and what was the first challenge that you I'm sorry, English. The main challenge that you need to resolve.
I think the question is for you. Es para ti la pregunta.
Yes. Sorry.
Well, the implementation of a new project in the hospital always involves difficulties and tends to be a slow process. With regard to the steps that we have taken at organizational level, it has been very helpful for us that the sepsis code was already implemented in the hospital. So most of the structure was already in place. In other step, we had to develop a new research project to be approved by the ethics committee. In the administrative level, and I think is the most important for us, an additional change is in the case of B-Alert project was that our regional healthcare system, SESCAM, may be interested in a future implementation across the other hospital of Castilla-La Mancha. So, from another point of view, the project that doesn't belong solely to our hospital, but rather to the hospital of the rest of Castilla-La Mancha. Then, to obtain consent for different agreements, it's necessary to consult various departments within our health system. It's important to identify which are these departments to ensure proper coordination and communication. So, for me, a good tip is that you have to know who's behind the door before you knock.
Yeah.
Other tips, proper planning, effective communication, commitment from all involved parties, ask for help, sure, like real life, if you need, patience, insistence, and express and transmit the qualities, the benefits, and strengths of the project, and just believe and trust in this, I think.
Okay, thank you very much, because I think this could be very useful for the audience to understand what are the previous steps, okay, before to start with the project, and how many things we need to do from the administrative point of view, from the authorization of the project itself, and also from the security point of view, privacy, and everything that has relation with the setup of the project. So thank you very much to share with us. And also, I like to add to all of this that to be able to execute all of these steps, okay, you need time. And you need a lot of patience, okay? So because really each of the steps, okay, need time. And when you are waiting for a start, okay, also you are impatient to be able to set up the project. So, Marcio, would you like to share something else?
Yes, a few remarks, a few things. One, this project started as a research project in multi-center in 3 hospitals in Spain. No? After the retrospective study, we include more than 200,000 patients that this identify 9,000 of patients of sepsis or septic shock, no? That develop many different models based in traditional rows, traditional combination, traditional rows. For example, quick SOFA plus SOFA, sepsis 2, quick SOFA, and models of using only machine learning, and finally the machine learning plus classical rows, no? And the pilot phase, in actually that you use 3 models, no, based in the 3 parts, no? I think this is important because you make a internal validation of model, no? Retrospective, pilot, and after this prospective in all parts of hospital at warding in real time. No, it's very important, it's crucial, the external validation of this model, because those in Octubre, Albacete had a higher hospital, more complexity kind of patients. No? So this model must be adapted in different settings with different patients, of course.
Yeah, and also I'd like to remark in relation with that is during this process, currently the validation process that we did in Llàtzer, this is the numbers and the figures that we present for the CE market certification, okay? However, the CE market certification is a continuous process. So that means that every year, as soon as we receive the certification, every year we need to present the numbers in related with the execution of the tool in the different hospitals. So really, for instance, the plans that we have is to use the experience that we are going to have in Albacete and in Hospital 12 de Octubre to be able to support the audit next year, okay? So this is a continuous revalidation of the value of the model, okay? So, well, anything else that you'd like to share with the audience? Nothing? Well, first, thank you very much to each of you to have the power to be the champions on that project, okay? Thank you to the audience, thank you to the organization to allow us to have this space to share our experience. And of course, I have all the team here. The team is a specialized team in artificial intelligence and data analytics. So if you have any question, they are going to be here until the end of the sessions. So we are able to answer your questions at any time. Okay? Thank you very much.
Thank you.
Thank you very much.